Myself, Miss Priyanka Lokhande, working at Nursing College as an assistant professor. So I'm here to tell you all regarding the female pelvis. So today we are going to learn regarding the female pelvis. So let us start regarding the female pelvis. Now, as we all know that the pelvis has certain importance that is nothing but to support the body, right? So we'll see why the female pelvis is different from the male pelvis. So here are some of the differences which are been given. So these are nothing but we can see comparatively to the bones. So how the male and female bones are been differentiated. Now the bones is in the male is heavier and rougher comparatively to the female. Whereas the bones, if we see in the female pelvis, how it is lighter and smoother. Sacrum. Now coming towards the sacrum, the narrow and more curved is there in the male, and in the female how it is broad as, and even it is a less curved. So this is the difference between the sacrum. We can see over here, this is the model of the pelvis, and this is nothing but the female pelvis. Now as we have seen the difference further, that is nothing but the bones and the sacrum. So these are the bones of the female pelvis, and the female pelvis consists heavier and rougher bones comparatively to the male. Now these are the bones, and how they have said that this is the heavier and rougher bones comparatively to the females. So male have that heavier and rougher, and females have a bit lighter and the smoother. Now sacrum. How is the sacrum in the male? The sacrum. So this is the part called as the sacrum. We can see over here. So this is the sacrum, and the sacrum in the male is narrow and more curved. Whereas in the female, they have said that it is bordered and it has a less curve. And next coming to the ilium. So this part is called as the ilium. So how they have said in the male, the ilium is lesser lateral flare, and whereas in the female it is a greater what has a lateral flare, and the greater sacral notches is nothing but the male has a deeper notches, whereas in the female it is a smaller notches. And iliac fossa, and iliac fossa, how it is, the iliac fossa is nothing but this is the part, or this part is called as iliac fossa, and the iliac fossa in the male is deeper, and in the female it is bit shallower. So this is the most we can say the wider difference between the male and the female pelvis. Going forward, over here they have told regarding the features of the pelvises. Now in the humans there are four types of pelvises we contain. These are nothing but the gynecoid pelvis, android pelvis, anthropoid pelvis, and platyploid pelvis. Now the female usually consists gynecoid pelvis, whereas the male consists the android pelvis. So over here we can see the differences over here according to the types of the pelvises. According to the types of the pelvises. Now we'll see the first feature, the difference in this four is the bream. Now how the bream in the gynecoid pelvis? Yes, before going to this, why the female pelvis is called as the gynecoid pelvis? Because this pelvis is favorable to give the birth of the baby. So the comparatively to the male pelvises, the female pelvis is favorable to give the birth for the baby. Now we'll see the features. The first feature over here they have given is nothing but the bream. Now in the gynecoid pelvis they have said that the bream is the most rounded surface, or we can say the rounded curve which the female pelvis or the gynecoid pelvis consists, and the android is of heart shape. The bream of the android is of heart shape, and this heart shaped pelvis is nothing but the android pelvis, and this consists the male pelvis. Then is anthropoid pelvis. So the bream of that particular anthropoid pelvis is long oval. So this is the long oval. We can say the bream of the anthropoid pelvis is long oval. Next is the platyploid pelvis, the bream. It is kidney shaped. So these three pelvises, that is the android pelvis, anthropoid pelvis, and platyploid pelvis, is not favorable to give the birth cause its bream is not rounded. So only the gynecoid pelvis consists the bream, that is the rounded shape. Next is four pelvis. So four pelvis. It is generous. The android pelvis, they have said it's narrow. Next, anthropoid pelvis, even they say that it is narrower. And Platyploid pelvis, it consists the what wider part of this. So it is not favorable. So these three comparatively of the four pelvises is false, as well as the gynecoid pelvis again here gives the favorable condition. Then the side walls of the pelvis. The pelvis of the gynecoid pelvis says that it is straight, as well as the android itself, it is convergent, then is divergent, and in the platyploid also they say it is divergent. So again here the gynecoid pelvis is favorable to give the birth. Ischial spines. So these are the ischial spines which gives or which denotes the station of the baby when we do the per vaginal examination while doing the normal vaginal birth. So we measure the what? These are the ischial spine, and on this ischial spine we can recognize the station of the baby. If the baby's head is at the level of the ischial spine, then we consider it as a zero station. Whenever the baby's head is below the ischial spine, we consider it as a plus station. And whenever the baby's head is above the ischial spine, we consider it as a minus station. So ischial spine over here, they have said the gynecoid pelvis contains the ischial spines a bit blunt. We can see over here also the spines are a bit blunt. It's not sharp. Whereas in the android pelvis, they have said that prominent. How it is? Prominent. So it is a bit sharper comparatively to the gynecoid pelvis. Then anthropoid pelvis, it is blunt, as well as platyploid pelvis, it is blunt. Then is sciatic notches. So these are the sciatic notches. Regarding the sciatic notches, they have said that in the gynecoid pelvis it is rounded shape. Android pelvis, they have said it is narrower, and in the anthropoid, they have said it is wide, as well as in the platyploid. Then the subpubic arch. So this is the subpubic arch. They have said that in the gynecoid pelvis it is 90°, whereas in the anthropoid pelvis it is less than 90°, and anthropoid and platyploid, they have said it is more than 90 degrees. So this degree of the what suprapubic arch is what it has to be 90 degrees. So in the other three we can see it is greater and smaller. And incidence, they have said that 50% of the incidence, they have said that the gynecoid pelvis is very favorable pelvis to give birth for the for the babies. So we can see the difference over here. Now, yes, so you can see the difference over here which is given in the images. So how the beam of the android pelvis is platyploid pelvis, gynecoid pelvis and anthroid pelvis. So the part which has been given at this side with the gray denotes the shape of that particular beam of the pelvises. Okay, so this we can see the female pelvis, how it is been named. So in going in detail with the innominated bones, we'll start. So the pelvis consists two innominated bones, ilium and ischium. Ilium and ischium. Now when we speak about the ilium bone, so this is called as the iliac crust. So this is called as the iliac crust. When we place our hand on the hip, it is been placed on the iliac crust. This is called as iliac fossa. It is called as iliac fossa. It is concave in shape. This is called as a gluteal fossa. It is convex in shape. It is convex in shape. Next, we can see over here the spines of the ilium. The spines of the ilium. This pelvis consists, this part has been called as the anterior part of the pelvis, whereas this part is called as posterior part. When we take or when we want to display or when we want to tell regarding the pelvis, this is the manner to hold the pelvis, and the anterior part should be at the anterior side of our body and the posterior should be at our chest level. Now, when we speak about the spines of the ilium, so this is called as anterior. This is called as posterior. Now this anterior part contains two spines over here. So the upper part is called as anterior superior iliac spine, anterior inferior iliac spine. So this is at the superior side. So it is been named as superior. So anterior superior iliac spine, anterior inferior iliac spine. At the posterior, it contains the same two spines, but the names goes posterior superior iliac spine, posterior inferior iliac spine. posterior superior iliac spine, posterior inferior iliac spine. This is called as gluteal fossa. And this gluteal fossa is rough in touch as the gluteal muscles are attached towards it. So iliac fossa is a bit smoother and softer comparatively to the gluteal fossa. So the muscles over here, the gluteal muscles are being attached, and because of that this area is a bit rough in touch. See, we can see over here. So superior pelvic ramus, pelvic symphysis, inferior pelvic ramus, ilium, sacrum. So this pelvis contains the sacrum and coccyx. Now the sacrum is 5 fused bone, whereas the coccyx is 4 fused bone. So we have seen regarding the ilium. Now we'll see regarding the ischium. Ischium. Now in ischium, this is called as obturator foramen. Sorry, acetabulum. This is called as acetabulum, where the head of the femur fixes into it. So this is called as acetabulum, and this is called as obturator foramen. Obturator foramen. This is called as ischial tuberosity. This is called as ischial tuberosity. And previously only we have said these are called as the ischial spines. As we said that these are having some importance during the normal birthing, and this denotes the station of the baby. Station of the baby. So these we have seen that the ilium and ischium. So these are two innominated bones. The innominated word comes because the bones are not separated anatomically. So only we called it as a innominated bone. Now this is regarding the sacrum. We can see over here as I have explained previously. So sacrum is 5 fused bones. Sacrum is 5 fused bones. Next, over here we can see the coccyx. Coccyx is 4 fused bones, and this coccyx is only movable at the time of third stage of labor, or else it is not movable joint or a bone, we can say. Okay, so this was regarding the what? The bones of the pelvis. Now we'll see what are the joints of the female pelvis. So it consists of 4 joints. So first is symphysis pubis. Symphysis pubis, where 2 pubic bones joined together is called as symphysis pubis. Next is sacroiliac joint. Sacroiliac joint. So this is the sacro and ilium. So sacroiliac joint. Sacroiliac joint. So again, so it has a left and right. So it is been said as a 2 sacroiliac joint. So female pelvis consists 2 sacroiliac joint. Sacrococcygeal joint. Sacrum and coccyx are joined together. So it is been called as sacrococcygeal joint. So these are the 4 joints which we have seen, followed by the ligaments of the pelvis. So again the ligaments are being grouped into the 4. Those are nothing but the sacroiliac ligaments. Sacroiliac ligaments. So sacrum and ilium. So usually where the joints are present, the ligaments are also present. So 4 groups which they have said is sacroiliac ligament, sacrospinous ligament, and sacrotuberous ligaments, and sacrococcygeal ligament. So these are the 4 groups we can see over here, and interpubic ligament and interpubic ligament. We'll see once again regarding this. That is the sacroiliac ligament, sacrospinous ligament, sacrospinous ligament, sacrotuberous ligament, sacrotuberous ligament, sacrococcygeal ligament, sacrococcygeal ligament, and interpubic ligament. So these are some of the ligaments in the pelvis. Coming towards the landmarks. So we have 9 total landmarks in the female pelvis. So landmarks are very important when the woman is giving birth to the child. If this landmarks denotes that where the baby's head is during the normal delivery. So we need to know the landmarks of the female pelvises. Now starting from the symphysis pubis. So starting from the symphysis pubis. So this part is called as symphysis pubis. This is being called as symphysis pubis. Followed by this is the pubic crust. This is called the pubic crust. The pubic crust is bit rough in touch. Then is pubic tubercle. Pubic tubercle. Pubic tubercle. Pectineal line. So here we can see this is the pectineal line. Iliopectineal eminence. Iliopectineal eminence. Iliopectineal eminence. Iliopectineal line. Iliopectineal line. Sacroiliac articulation, or we can even say it is a sacroiliac joint. Then is anterior border of ala of sacrum. So this is called as ala of sacrum. The wing like the shape is called as ala of sacrum or wings of sacrum. So we can either also say the wings of sacrum and the sacral promontory. So these are the 9 landmarks which are very important whenever the woman is giving a normal birthing. So it denotes where the head of the baby, it gives the contact or it shows the contact of the baby's head with the pelvis. And from this also we can decide whether the pelvis is favorable to give the birth normally or no. So these are some of the landmarks. Once again we will see that is the symphysis pubis, pubic crust, pubic tubercle, pectineal line, iliopectineal eminence, iliopectineal line, sacroiliac articulation or sacroiliac joint, anterior border of the ala of sacrum, or we can say as a wings of sacrum or the wings of sacrum, and this is the sacral promontory. This is the sacral promontory. Now coming towards the diameters, which is most important for the pelvis, and obviously whenever we are doing the normal birthing, this diameter should be in a proportion with the cephal of the baby. So if the ratio of this cephal and the pelvis is not in the proportion, then we call it as a cephalopelvic disproportion. In that case, the mother is not able to give the birth to the child by normal vaginal delivery. In such kind of cases, we have to perform the caesarean section. Now we can see what are the diameters of the pelvises. Now in this pelvis, we can see that this is the brim of the pelvis. The upper part of the pelvis is called as a false pelvis, whereas the lower part of the pelvis is called as true pelvis. It is all because this part of the pelvis doesn't have any direct contact during the normal birthing of the baby, whereas the lower part of the pelvis has a direct contact during the normal birthing of the baby. So it is been said as a false pelvis, and the brim and the lower part of this is called, or the inlet is been called as a true pelvis. Yes. Now, when we see the pelvis, it is being divided as the anterior epidiameters, the oblique diameters, and the transverse diameters. So, when we see the brim or the inlet or the outlet, so all these three contains what? Anterior posterior diameter, oblique diameter, and the transverse diameter. So all this brim contains three what? Diameters. Now when we are speaking about the brim, let's see regarding the anterior posterior diameters. Now AP diameter consists the conjugates. So which are those? Those are nothing but anatomical conjugate, obstetrical conjugate, and diagonal conjugate. Now on this basis, we'll see what is the anterior conjugate. So anterior conjugate contains, or it consists of 12 centimeter. Now how? So anatomical conjugate starts from the upper border of the symphysis pubis to the upper border of the sacral promontory. So this is called as the anatomical conjugate, and it measures 12 centimeters. Now when we speak about the obstetrical conjugate, it is from 1.25 centimeter of the symphysis pubis till the upper border of the sacral promontory. So this we can say it is a what? Obstetrical conjugate. And diagonal conjugate is nothing but it starts from the upper border of the symphysis pubis to the lower from the upper border of the sacral promontory to the lower border of the symphysis pubis. It is 13 centimeters. When we are considering the AP diameter, the only diameter in the beam, we have to consider that is the obstetrical conjugate, that is 11 centimeters. Now the oblique. Now we'll see the oblique. So oblique diameter is of 12 centimeters. Now it measures from the sacroiliac joint, from either of the sacroiliac joint. It can be a left or a right. So it goes opposite. So the left sacroiliac joint to the opposite iliopectineal eminences. So this is of 12 centimeters. Then the transverse diameters. Transverse diameters. It is between the two iliopectineal eminences. So whatever the two iliopectineal eminences is, that distance is called as 13 centimeters, and it is a transverse diameter of the brim. It is the transverse diameter of the brim. Yes. Now when we are speaking about the cavity, yes, when we are speaking about the cavity, cavity forms, as we have seen in the previous things also, that the cavity is a rounded shape. It is what? Rounded or circular in the shape, and because of that, all the diameters, whether it is the anterior posterior diameter, whether it is a oblique diameter or a transverse diameter, all this diameter contains 12 centimeters. So as we know, whenever it is a circle, the diameter always comes the same, that is the 12 centimeter. When from wherever we measure, it comes the 12 centimeter. Now coming towards the anterior outlet. Now in the outlet, again we have three diameters in the outlet also, that is the AP diameter, then is oblique diameter and the transverse diameter. Now in the outlet, the AP diameter starts from the lower border of the bone to the sacral promontory ligament, lower border of the bone to the sacral promontory. So this is the AP diameter, and it is 13 centimeters. Then is oblique diameter from the from the sacrotuberous ligament to the mid of the obturator foramen. So sacrotuberous ligament to the mid of the obturator foramen. So this is the imaginary diameter, and it is of 12 centimeters. It is of 12 centimeters. And the transverse diameter is between the two ischial spine. Between two ischial spine, it is 11 centimeters. So these are the diameters of the pelvis. Yes, pelvic inclination. When a woman is in a standing, when the woman is standing in the upright position, the position of the female pelvis is in an incline, and it would have a 60 degree of the degrees formation of the angle, with the floor at the center of the pelvis, the pelvic 30 degree, and at the outlet it is 15 degrees. So this was regarding the female pelvis. I hope so that you have understood regarding the female pelvis. Thank you so much.